Good morning. I am Dr. Meenakshi Deshpande. I am a practicing consultant senior gynecologist and obstetrician from Pune. I practice in Pune Sinhagad Road area and I have been practicing since last 28 years. How many patients I have seen in pregnancy and how many patients are delivered are innumerable, absolutely. But still, I want to give a few tips to all those who are watching this video. The first and the foremost thing is the preconceptional care. Preconceptional care is very important to achieve a good and a normal pregnancy. If you have any illnesses before you are pregnant, suppose you are having some thyroid problem, some gestational, or you can have a pre-gestational diabetes problem, you are having hypertension, or you are having a bad obstetric history, please go to your gynecologist or obstetrician 6 months before your probable day of conception. And that is going to help you a lot, because if you don't go put yourself on proper vitamins, put yourself on a proper conceptional treatment therapy, preconceptional therapies, you are bound to go into recurrent abortions. What can you do for achieving a healthy pregnancy will be my first topic. To achieve a healthy pregnancy, first of all, you have to keep your BMI in place. You have to have a proper weight to height ratio. Your weight should not increase disproportionately to your height, and that is going to hamper all your endocrinological systems in your body. You can have an altered metabolic system because of increased fat in your body, decreased physical exercises. So girls, I will just advise you to go in for an proper dietary advice, a proper exercise pattern in your daily busy routine, plus having a daily vitamin and multivitamin levels in your body, because that is going, especially folic acid. You must have a good proper amount of folic acid intake at least 3 months prior to your conception, so that you achieve a normal fetus, a normal growing embryo in your body. Okay, so now you are pregnant. After you become pregnant, what are the few things which you must do? The few things you must do is not to assume that you are pregnant. You do a pregnancy test and go to a gynecologist in between 8 to 10 weeks of your pregnancy, so that your obstetrician does a obstetric scan, ensures that the pregnancy is growing properly, pregnancy is growing in the proper place, and pregnancy is according to your gestational age. After that, if that is going properly, then the next test comes according to your age. Suppose you are about 30 years of age, you should go in for a double marker test. A double marker test and an obstetric scan at 11 to 12 weeks with an NT scan will tell you a little bit about the development of the fetus, and if it is a bit abnormal, then your obstetrician might advise you a few more tests like amniocentesis or quadruple marker. And these are very important for you to develop a normal pregnancy. Means you should be able to diagnose whatever problems you are having in that fetus by about 18 to 19 weeks. Because as you know, in India, our range of abortion, we can give you an MTP service, or we can give you a safe abortion service till 19 weeks of pregnancy. So before 19 weeks, you can do as many tests as possible to diagnose whether your baby which is growing in your womb is normal or not. Of course, at the same time, you must also remember that not all tests are 100%. You can have a direction of about 95 to 98% saying that your baby is not growing properly, or your baby might be having this sort of conditions, or your baby has got some problem. So if a doctor, if we or as consultants advise you on doing an MTP, please take that thing as seriously. If there is a risk factor, we will advise. If there is no risk factor seen in those tests, we can advise you that you can continue your pregnancy, but be careful about the other 5% which we cannot diagnose, in spite of all the possible best tests which you can undergo. After that comes your second trimester. In second trimester, what problems you can face? You can face is PV bleeding. You can face is anything with pains and preterm labor. So the best thing is to advise again is a little bit of rest, little bit of exercises, proper vitamin supplementation, iron supplementation, calcium supplementation, and a proper diet. Of course, a proper diet in first 3 months is not much more healthier, but from the 13th week onwards to 26 weeks, you can have a proper diet, because that is supposed to be the healthiest days of a pregnant woman. If you have a proper diet during those times, you can of course avoid many problems like pregnancy-induced hypertension, gestational diabetes, hypothyroidism and preterm labor. So your diet, your exercise, your yoga, your antenatal things, mental stress, all should be in a proper direction and a proper methodology to train yourself for a proper labor, which can come in the third trimester. Now, what are the red flag signs in the second and the third trimester? At the end of second trimester and the beginning of third trimester, if you anytime you have a PV bleeding, anytime you have swelling of your legs, anytime you have your abnormal vomiting sensation or a severe headache, or you can have a urinary tract infection, urine infection, please approach your doctor. Please approach a consultant gynecologist and obstetrician immediately to prevent your further damage to your systems. That will be the red flag signs. And what else you can have in the second trimester and third trimester is a vaccination. Vaccination we are advising nowadays is much more different than what we used to advise 10 years before. Why? Because nowadays we are having the first vaccine as a swine flu vaccine. This is advised by the government of India and which is recommended between 15 to 18 weeks of pregnancy. The swine flu vaccine should be administered of the latest strains between 15 to 18 weeks of pregnancy. The next vaccine which comes is the tetanus vaccine, which used to be given about 3 months back. But now, not 3 months back, 10 years back. Nowadays we are having a combination vaccine which has come up. It is tetanus and diphtheria. Tetanus and diphtheria combination has been advised internationally for all pregnant women, and the last vaccine which is advised is Tdap, that is tetanus, diphtheria and pertussis. And this is about a whooping cough vaccine which has been advised again internationally for all pregnant ladies, the last vaccine to be given between 30 to 32 weeks of pregnancy. And this will ensure not only the protection of the mother, but it also ensure a passive protection of the fetus which is growing. By transferring these passive antibodies from the baby, from the mother's blood to the baby, you are ensuring the safety of your baby for the first 6 months in the life. Because when the baby is born and when the baby gets immunized, the protection starts after 6 months. So if you have to ensure the baby is protected in the first 6 months of life, please ensure that the mothers get these vaccines between 20 to 28 to 30 weeks of pregnancy. So 16 weeks of pregnancy till 32 weeks of pregnancy, we advise 4 vaccines in primi gravida. The first will be swine flu, the second will be the first dose of TD, the third will be the second dose of TD, and the last will be a Tdap. So this will cover your all vaccinations against all diseases, majority of the diseases you can say, by the last trimester of pregnancy. So this is the second concept of immunization which has come up very big way nowadays. What is the third concept? The third concept is prevention of gestational diabetes. For that you have to keep a watch on your DIPSI. Now what is a DIPSI? DIPSI is a test, a 2-hour postprandial test of blood sugar level, which is done when you come into the clinic on the first visit and repeated every 4 weeks, say 22 weeks, 26 weeks and 32 weeks, to get an idea of whether you are having an increasing postprandial blood sugar level. If by any chance a doctor feels or a laboratory reports comes up that your postprandial blood sugar level is above 120, you have to go in for a rigorous diet regimen and go in for a detailed blood sugar monitoring, because the moment your blood sugar levels start increasing beyond 120, the baby, the dangers to the baby because of your blood sugars start increasing, and these are the babies of diabetic mothers which we declare after delivery. So if you want to decrease the aspects of diabetes in pregnancy or dangers of diabetes in pregnancy to yourself and to your newborn baby, please ensure that you keep your postprandial sugars in proper levels. And for that you may have to repeat fasting PP sugars after every 4 weeks. And even if the doctor tells you, and if you don't do it, then it is you who will be facing the brunt of the problem, because all these problems show up at the time of delivery. You have to keep a proper watch on your blood pressure, a proper watch on your fasting and PP blood sugar levels, and a thyroid checkup done every trimester so as to maintain a proper growth of your baby and a proper delivery of a baby at normal time. So I think this is the proper antenatal course which we advise for all the antenatal mothers at present. And I hope you have a normal delivery also, but that talk I'll give a little bit later on how to achieve a normal delivery. So these are all the red flags and the vaccinations during pregnancy which I have talked to you just now. Thank you.